Well, good morning. We'll go ahead and start this morning's update with the numbers from yesterday. Today we have 102 new positive cases for a total of 1,048 positive cases. We have 3 new counties, Buena Vista, Delaware, and Greene, for a total of 78 counties. We have 1,017 negative cases today for a total of 11,670 negative cases. We have 1,690 available tests at the State Hygienic Lab. As of last evening, we have 104 hospitalized, and we have 341 recovered. I am sorry to report again today that we have had 1 additional death, an elderly adult from Benton County, for a total of 26 deaths in Iowa. 11% of the positive cases are long-term care staff and residents, and 46% of the deaths have been long-term care residents. So many Iowans have expressed interest in the Iowa National Guard's role in our COVID-19 response and how they are being engaged to help mitigate the spread of the virus. The Iowa National Guard plays a critical role in any disaster situation and is a vital part of my COVID-19 response team. In previous press conferences, you've heard about the missions they're conducting across the state to ensure that PPE is available for healthcare workers. But their responsibilities extend much further and are integral to our entire response operations, especially in the coordination of healthcare resources across Iowa. Today, I've asked Adjutant General Ben Corral to join me and provide an overview of how the Iowa National Guard is supporting our state during this unprecedented time. General?
Thank you, Governor Reynolds, for the opportunity to provide an update on what the Iowa National Guard is doing to support the people of Iowa as we work collectively with your entire response team to mitigate the effects of COVID-19. The soldiers and airmen of the Iowa National Guard are proud to be a part of the solution as we all work together during this unprecedented challenge facing Iowa and our nation. We currently have over 200 Iowa National Guard soldiers and airmen on duty directly supporting the state's response efforts. We are prepared to increase our numbers as conditions change. As we speak, Iowa National Guard transportation units are on the road delivering vital medical personal protective equipment out to county emergency management facilities across our state. Since these PPE missions began last month, we have delivered PPE to all 99 counties in Iowa, and in many counties, we've made multiple deliveries. This is a critical mission that we are conducting every day, keeping this vital PPE pipeline flowing to points of need across the state almost as quickly as it arrives in Iowa. In addition to the robust planning and coordination cells we've established here in the Iowa Joint Force Headquarters to help manage our efforts with the state's Emergency Operations Center, I have also activated 3 additional task force headquarters across the state to support our pandemic response activities. These task forces, led by a senior Iowa National Guard commander, are designed to provide planning, coordination, communication, and command and control of military forces activated in support of our local, state, and federal partners on our regional response efforts within the state. At the direction of the governor, we've established 6 regional medical coordination centers, or RMCCs, in support of the Iowa Department of Public Health and the Iowa Healthcare Coalitions. These coordination centers are located within the 6 healthcare regions across the state of Iowa at Iowa National Guard armories in Iowa City, Cedar Rapids, Camp Dodge, Mason City, Council Bluffs, and Sioux City. Regional public health officials, supported by our Iowa National Guard soldiers and airmen, are staffing these centers to support healthcare providers, allowing them to make informed treatment decisions based on immediately available resources like open beds, available staffing, personal protective equipment, and other critical healthcare assets. In short, RMCCs help facilitate multi-agency and civilian partner communication, critical information sharing, and coordination of healthcare-related resources across the regions that they serve. This scalable capability is a critical resource available to help decision makers save lives as conditions within the region change and normal response processes are no longer an option. Iowans are used to seeing our soldiers and airmen responding to floods, tornadoes, winter storms, and other natural disasters. The strength of our organization is in these soldiers and airmen who live and work in your community while serving part-time until we need them to answer the call. We are now answering the call, and we will always be ready to support our fellow Iowans. My commitment to the governor is that the Iowa National Guard will not be late to need in support of any state mission. My role as the Adjutant General is to provide the governor my best military advice on how best to use the capability of the Iowa National Guard as we collectively work together with our state and federal partners to support the people of Iowa and mitigate the threat from this virus until it has been defeated. Thank you.
Thank you, General. I also want to thank all the soldiers and airmen of the Iowa National Guard for their services to our state. We deeply appreciate the sacrifices you and your families make whenever duty calls. Please be safe and stay well as you serve on the front line of this crisis. As General Correll stated, the RMCCs are a critical resource to support healthcare providers at this time. Under normal circumstances, Iowa's healthcare coalition regions are served by separate healthcare systems, community hospitals, and independent providers. But during an emergency, especially one the size and scope of a worldwide pandemic, it may become necessary to pool resources and work together as one health system, serving the needs of a region or the entire state. And this is what the RMCCs are proactively planning for. Last week, we shared a map representing Iowa's six healthcare coalition regions. And today, I want to take a closer look at two of those regions and explain how the RMCCs can enable care coordination between providers to ensure the right care at the right time and in the right place for Iowans in need. So, for instance, RMCC Region 5 includes the southeast corner of the state and includes Johnson County, one of the state's hotspots and a county where our first positive COVID-19 cases were identified. As of yesterday, 20 COVID-19 patients were hospitalized in Region 5. 3 had been admitted in the last 24 hours, 7 were in ICU, and 3 were on ventilators. At this time, there remain 713 inpatient beds available in the region, 94 ICU beds, and 181 ventilators available and ready for patient care. RMCC Region 6 covers the northeast corner of the state, and it includes Lynn County, another of the current hotspots in the state. As of today, 77 of Lynn County's 184 total positive COVID cases are related to an outbreak in a single long-term care facility. We know older adults over the age of 60 and those with underlying health conditions are at the highest risk for serious illness from the virus and may require intensive care. We have 50 COVID-19 patients hospitalized in Region 5 as of yesterday. 6 had been admitted in the last 24 hours. 27 were in an ICU, and 17 were on ventilators. During this same time frame, there were 1,004 inpatient beds available, 57 ICU beds, and 110 ventilators available in Region 6 hospitals. Despite our increasing cases, our patient volume in these regions is manageable. Hospital capacity is strong, and ventilators are in good supply. This is encouraging, but we are in a very fluid situation, which is why we continue to monitor everything very closely on a daily basis. Understanding our bed and vent capacity and intensive care capabilities within a region enables us to effectively coordinate care if patient volume dramatically increases. If critical equipment like vents are in short supply at a facility, the RMCC will coordinate moving them from one location to another to accommodate the need. Even patients can be transferred to a different facility if their condition demands a higher level of care. As we progress toward an anticipated peak of positive cases later this month, the RMCC's ability to monitor patient volume, acuity, and availability of resources will better enable our health systems to surge and flex to accommodate increased demand across the region. I want to extend my gratitude to Iowa's primary health systems, including UIHC, Unity Point Health, Mercy One, and Genesis, as well as all of the community hospitals across the state. Your commitment to coming together as one system to serve Iowans during this unprecedented time is admirable. So thank you for everything that you're doing and for what you and your teams will do in the days and weeks to come. Thank you. And with that, we will open it up for questions.
Governor, your office said last week they're going to release a projection of the number of COVID-19 cases. Do you have any updates on when we can expect that projection?
I think what we said last week is that we're working on modeling, and we're looking at an agreement with the University of Iowa College of Public Health. We've been actively working to get that agreement in place, and the first part of that work will involve analyzing existing models that exist, like the University of Washington model that we've talked about previously. There are a number of different models out there. And so we'll first be asking them to kind of analyze that information that currently exists, and then from there, the plan is to transition into more modeling and forecasting for Iowa to the extent that modifications to those existing models, to the extent that there's interest in continuing to modify those existing models. So we're working on it. We don't have it, in hand yet, but it's actively work in progress.
Do we still expect it this week? I know the governor's chief of staff told lawmakers last week that it perhaps could come this week.
I think we'll have what we'd anticipate this week is some analysis of existing models and how they may or may not account for mitigation measures that the governor has taken, that the governor has put in place. In terms of the modeling and the forecasting, that does take some time. It's not something that can be done in a day or two. And so I don't think we have a firm projection yet from the University College of Public Health in terms of when exactly we'll be able to have that, but do know that we're working on it, and we hope to have it in the days and weeks to come.
The data about patients who've recovered, what are the benchmarks you're using to determine that someone's recovered? Are they getting retested? I know testing supplies are limited to begin with, so I'm wondering what Iowans can know about someone who's actually recovered and safely can say that.
Yeah, so what we're looking at in terms of recovery is that we're not doing test-based recovered measures at this particular point in time due to our limited number of tests that we do have available. So what we would consider to be somebody who is a recovered case is somebody who has self-isolated for at least 7 days after the start of symptom onset, and then for at least another 3 days after the resolution of their fever or their other symptoms.
How do you account for those asymptomatic people, though, in that situation? Like, is that any consideration of how people might be showing symptoms? I mean, is there any data about people could be showing them later or sooner, and how do you account for that?
Well, I think that's why we continue to recommend that when people leave their homes, if they need to leave their homes, that they practice social distancing to avoid any potential spread of the virus from individuals who may be asymptomatic. And so that's why really the recommendation continues to be for everybody to stay home, leave only if you have to leave for essentials like going to the grocery store or going to the pharmacy. And when you are out in public for those essential errands, to make sure that you maintain at least 6 feet of social distancing from others.
Governor, I actually have another data question. Other states have broken down COVID-19 cases by race, released nursing homes, and then kind of given the number of healthcare workers in those COVID cases that have been diagnosed. Does Iowa have plans to break down the data further to these points?
On the website? Well, okay. I'll just consider relaying it.
That's fine. At this point in time, we don't have plans to release case counts by race and ethnicity. At the end of every outbreak, we do an outbreak investigation report. And so once we get to that particular point in time, we might be ready to release some of that information. At this point in time, the way that the information is collected by the department, we don't have statistics that I think we would consider to be accurate and complete related to some of that race and ethnicity information. So that's not something that we plan to release at this particular point in time. And I'm sorry, but there was another part of your question.
Yeah, about healthcare workers.
Oh,
who have
healthcare
been-
workers, yeah. Yeah, we do have some information about the number of our cases that are healthcare workers, and right now that's at about 22%, 23% of all of our total cases are healthcare workers, which is why it is so important for people to stay at home, because we need to make sure that that healthcare workforce is protected and stays well.
You don't have statistics on race, or what are you, like, what is the private labs and the state lab actually getting? Is it just what we're seeing, the ages and the counties of residence for data? Sorry, this is your day.
No, it's okay. There are a number of data variables that are collected, but it's not always complete information. And so what happens is we'll get a positive test result, and then we have our disease investigators that do the follow-up questions with patients and obtain charts and that sort of thing. So it kind of depends on the completeness of the information that we have, depends on the completeness of the information that comes to us. So it takes us some time as we do those investigations to get complete information about each patient that has been identified as a positive case. So it's not like when we get the positive test result, all the other information flows with it. It takes time for our local disease investigators to follow up on those cases to really provide an accurate snapshot of that information. And so we continue to work on data collection processes, and we'll continue to do that over time. But the other thing that we're always sensitive about is releasing any information that might make a potential case personally identifiable. And so patient confidentiality is one of our utmost concerns. And so when we're thinking about releasing data, that is always also in the back of our minds, making sure that we do that in a responsible way so that we're not identifying individuals.
And that's one of the reasons, Caroline, that our numbers are delayed there last night, because it gives our team time to do some of those fact-finding.
Can you say how many long-term care facilities at this point are impacted and where those facilities are located at?
Yeah, currently we have confirmed 3 long-term care facility outbreaks. There's one in Lynn County, and that's Heritage Specialty Care. We have one in Washington County, and that's the McCready Home. And then we have one in Tama County, which is the Premier Estates of Toledo.
Obviously, the long-term care outbreaks are part of that metric system that you guys are using to determine, shelter in place and other mitigation strategies in these regions. I'm wondering, again, if you can share anything more about where the science comes from behind that metric system. And I think the governor said yesterday that other states are looking to Iowa. Can you share a list of what states are asking for Iowa's
Well,
system?
first of all, so last Friday, we spent the entire press conference highlighting the expertise and the team that put together the metrics. And so I would go back and ask people to take a look at that. We spent the whole press conference really identifying the experts that we have, the epidemiologist team, the number of years that they've been working on various outbreaks. And we also said that we've got the metrics that we're looking at, but we're also looking at different assumptions. The epidemiologist team talks to epidemiologists in other states all across the country. They're working with the CDC. So, there's a lot of conversations that are going on. We learn from other states and what they're doing, and information is constantly shared back and forth. I also do at least 1 or 2 calls a week with governors from across the country so that we can highlight what they're doing, what they're seeing, what are some of the outcomes, what's been successful, what hasn't, what are they mapping, what aren't they. So all of that is, we take a look at all of that when we're putting together what the recommendations are going forward. I don't know if you have anything you wanted to add to that. But.
The only thing else I would add, see, and I brought a binder today, so I'm organized with my papers and I'm not flipping them all around, but there's this nice document that the CDC put out, and it's been out for several weeks. We've been looking at it. We were looking at it before the governor made her recommendation related to school closures. And so I would encourage people to take a look at this particular document. A lot of the metrics that we're looking at in the community mitigation guidance document that you guys guys are referring to. A lot of the roots of that can be found here. And as the governor mentioned, there are also a number of other things that we look at in addition to what has been articulated in the document, but a lot of that is based on things that the CDC put out. And the title of the document is Implementation of Mitigation Strategies for Communities with Local COVID-19 Transmission.
We'll do one more question in the room.
Can you say if these regions' scoring has increased in the past day, and in particular, has the eastern region of the state moved up in any way closer to that number 10?
Oh boy, I bet I don't have it. I think both, oh, she does. Okay, I think they're a 9. Right, yeah, okay. So, no, excuse me. So Region 5 as of today is a 9. Region 6 is an 8. Region 2 is a 7. Region 1 is an 8. Region 4 is a 6, and Region 3 is a 6. And that aligns, of course, with the cases that we're seeing with the long-term care breakouts. But again, the point I wanted to make, and what I tried to make by showing you the metrics that we're looking at, is to make sure that we're preserving the hospital capacity for COVID-19 patients. And as you can see, for instance, in Region 5 and Region 6, when we look at vents, we're just at 2% usage of available in Region 5, and we're at 15% usage of available in Region 6, which is the Cedar Rapids and the Iowa City regions, which are the hot spots right now. And, that would be comparable. We can look at the statistics for bed availability, for ICU, for vents, so that we can do exactly what the general talked about. Take a look at it from a regional perspective, understand where the equipment, the PPE, the bed availability, and the expertise is at, so that if we have to move or adjust, we have the capability to do that, and we have that data in all 6 regions. So we'll be highlighting the other 2 regions tomorrow and kind of try to give you on a daily basis the overall usage, availability, and what we're seeing as we move through the COVID crisis.
Beth at KCRG, go ahead.
Thank you so much, Governor. I have a question about long-term care facility. When it comes to management from the Iowa Department of Public Health, our guidance regarding influenza outbreak is an outbreak is defined as one lab-confirmed influenza case and other respiratory illnesses on the same floor. But when it comes to an outbreak for COVID-19, which as we know is a much more serious disease, it requires 3 confirmed cases. And our neighbor to the north, Minnesota, defines an outbreak of COVID-19 at a long-term care facility as 1 case of a resident, a staff member, or a contract worker. And I'm just wondering about that disparity. And if Iowa were to adopt Minnesota's definition, or even Iowa's own influenza definition, how many outbreaks would Iowa have among its 440 long-term care facilities?
I think that was respiratory illness, not necessarily a breakout, but.
Yeah, so I can answer that question, and the answer to that question is 0. We have asked all long-term care facilities in the state to let us know if they have 2 or more residents or staff that are experiencing signs of respiratory illness. And so we've asked them to do that. We are paying close attention to those respiratory illness reports. But then in addition to that, as it related specifically to COVID-19, we don't have any facilities at this point in time, as of this morning, that have confirmed cases in residents other than the 3 long-term care facility outbreaks that I mentioned earlier.
Thank you, Sarah.
David Pitt, go ahead.
Yes, thank you very much. So, Governor, I'm wondering what happens when one of the regions hits a 10? Does that automatically trigger a shelter in place? And what will that mean specifically for that region beyond the closures you've already ordered?
Yep.
And one other question about the matrix that you're using. If your actions are in essence the same thing as the shelter in place, why not just call it that? And why do we have this 12-point matrix if we're kind of already there? Thank you very much.
Okay, thank you for the question. I appreciate that very much. And much like Iowa is not New York or California or New Jersey, we have different areas of the state that are experiencing different outbreaks. And so it would be irresponsible for me to just do a statewide when, according to Dr. Fauci, many of the mitigation efforts that I have put in place are actually aligned with the results that they're trying to get. And we're doing it on a community, county, region basis. We have the ability to take a look at what we're seeing happening across the state. And by using these metrics, then we will be able to, if we hit a certain point where we think we have to take additional actions or additional steps, we can do that. But as this moves across the state, and hopefully we don't see that happen on the western side or the north central part of the state, but if it does and things start to stabilize, we start to see a decline, and we're actually experiencing the outcomes that we want, we might be able to start to open up the eastern side of the state based on the data and the metrics that we're looking at that time. So, we believe in I believe in the data, I believe in the strategy, I think it's the right way to move forward. And we are working on what that looks like. There are different variables that we can take for the next step. So be rest assured, it is, if we feel that needs to be done, and that's the recommendation from the experts, we will move forward. But again, remember, the metric is a piece of what we're looking at. There's other assumptions that are going into the recommendations that are being made from the epidemiologist team, the Iowa Department of Public Health, based on the CDC guidelines, which they based a lot of their metrics on. Again, I think the more that we can do that, it's more consistent across not only the state of Iowa, but across the country. So we are working on what that looks like, and we will be ready to go if and when we need to do that.
Todd at KCCI, go ahead.
Good morning, Governor. We're getting some viewer calls, and they're concerned about packing plants and are they safe? If people are working in them, they're too close together, or they're worried about the food that's coming out of them.
Yeah.
Have you heard any of that, and are you taking any special measures to make sure that packing plants are safe?
Yeah, and they are always taking precautions, and now extra precautions to make sure that the food supply chain is safe. I did talk to the CEO a couple weeks ago of the different plants just to talk about making sure that they're keeping their employees safe, that we understand they're a part of the food chain and essential workforce, and recommendations that the Department of Public Health has made, for instance, taking temperature when you're going in, making sure that your employees know that if they're sick, stay home. If anybody in their household is sick, to stay home. If they're experiencing any of the symptoms, to call the doctor, go through the assessment. And so they were making it, and if you have to work, to make sure that they're practicing as many of the recommendations as they can. Be sure they're disinfecting often, and then we know that testing is a piece of this also. And so I did talk to Administrator Gaynor yesterday from FEMA to ask for additional test kits to utilize the Abbott testing machine so that we can start to get a handle on who is sick, who is not, and talk about how we stand up a workforce to continue to keep that food supply chain moving. And I do appreciate them closing down for a week so that they can take care of their employees and, again, take all of the precautions that they need to keep the supply chain safe.
Kathy Obradovich, go ahead.
Thank you very much, Governor. The Legislative Council is meeting Thursday. What, if any, requests are you going to ask the Legislative Council to consider? And have you advised them at all about when it might be safe for lawmakers to return and finish their session?
I think that they have extended through April 30th, so it aligns with the extension of all of my health disaster proclamations. At this point, Debbie will be part of the press conference tomorrow, the Director of Economic Development, to talk about the grant program that we put in place for small businesses, so we'll give you an update on that tomorrow. But we really want to understand what the expectations are and how we can utilize the CARES Act that was passed at the federal level, and so we're waiting to get more information on that before I will be making any additional request to the Legislative Council.
Nick at the Des Moines Register, go ahead.
Yeah, thanks for taking the time, Governor. To go back to kind of the workers question, we've been hearing from Iowans who work in businesses they feel are non-essential, such as non-healthcare manufacturing or non-food production or construction, and wondering they feel their jobs should not be essential or that their employer is not providing enough PPE to these folks when they go to work. I was just curious, do you have any message to those Iowans?
Yeah.
And do they have any recourse?
Yeah.
if they're not satisfied with the working conditions?
Yeah, well, I appreciate that question too. And I appreciate the Bar Association and Legal Aid actually was able to put a team together of volunteers for Iowans to call if they had questions specific to what you just addressed. And I would reiterate the number for legal questions, and it's 1-800-332-0419. So if you have any questions, that is a resource for you to see if you can get some response.
2 more questions. Second to last question is going to Joe, KBOE Radio.
Good morning, Governor. Just wondering what it is you would need to see in terms of the metrics to determine that Iowa has turned the corner and that it could be possible soon to start reopening things.
Well, we're always aiming for that day, and if Iowans continue to do what we've asked them to do, we've been very consistent in saying stay at home, only leave for essential reasons, go directly there and back, whether it's groceries, doctor, medicine, exercise responsibly. If you're sick, stay home and isolate yourself. And if we practice social distancing, if you have to go out, do not gather in groups of more than 10. And if we practice the metrics that we put in place, we will flatten the curve and we will get through this and we will get things back to normal sooner rather than later. Okay.
Last question, Rod over at Lee News.
Thank you, Governor. In the past 2 weeks, unemployment insurance benefit claims jumped to more than 100,000.
Yeah.
Do you expect a similar significant increase in DHS applications from jobless Iowans who may have to resort to Medicaid or Iowa's health and wellness program or other government help to cover their medical bills once their COVID-related or COBRA benefits run out and they can't afford to buy ACA insurance on the exchange or open market to avoid going uninsured?
Yeah, and Rod, we'll be watching all of that. I know, the CARES Act was to help small businesses, and really a big piece of that was to, they had to bring back their employees and stand the business up and keep them employed. And so we're trying to attack that very issue from a lot of different perspectives. So again, we'll take a look at what the Iowa CARES Act can provide for Iowans and for businesses across the state. We'll look at the grant program, which is kind of a stopgap until we can incorporate the CARES program through the SBA. And then we'll continue to, hopefully, again, if Iowans do what we ask them to do and stay steadfast in this short time frame, hopefully we can start to see that come down and we can start to have the conversations about how we reopen this economy and get things back to normal. So again, if Iowans can just do their part and really help not only protect vulnerable Iowans, but our healthcare workers, first responders, and essential workforce, we're going to get through this sooner rather than later and we can start having a much different conversation. Thank you.
Thanks, everyone.
Your meeting is ended.
We have broken the streak, and I am disappointed.